Hello, and welcome to this meeting on sheep abortion. In this meeting, we're going to discuss what I need to know to feel confident when talking about sheep abortion with clients. My name is Kat Baxter Smith, and I'm a ruminant veterinary advisor for MSD Animal Health. On the agenda today, we're going to cover when and why to take action, key causes of pregnancy and lamb loss, the main ones being toxo and enzo, securing lamb numbers through vaccination, other causes of abortion worth knowing about, and any conclusions. And we won't be doing questions today as this is a pre-recorded WebEx. But I will try and, as I go through the presentation, address any questions that came up previously. So when do most lamb losses occur? Actually, it's quite surprising, and many people don't realise that the vast proportion of lamb losses occur before birth. So a third of lamb losses occur in the tupping to scanning part. So your farmer might have his flock of sheep and they've been through tupping, and then when they're scanned, he's got a proportion of those that he thinks are empty and possibly barren, but actually they could have been in lamb but lost the lamb between conceiving and scanning. So these are ones that the farmer would write off as empty or barren, but actually it might be that there's an infectious cause there. Another third are lost as abortion or stillbirths between scanning and lambing. So again, those could be reabsorbed or aborted into the field, and the farmer not be aware of that until actually it comes to lambing and the ewe is empty. And again, that would be could be very likely to be an infectious cause. 25% are lost in the neonatal period, so that's the first sort of few days after being born. And obviously there are infectious causes to that, things like navel ill and joint ill, but it could be non-infectious, such as exposure or being sat on, so plenty of causes there. And then only 12% are lost post-turnout, so actually that's the lowest proportion of lamb losses occur at this point. So if we can address this before birth losses, the 60% of animals that are lost before birth, then we can really make a difference there to the numbers that are lost. So how do you know if it's too many? Because obviously most farmers will accept probably a small number of losses, and I think this can happen and maybe be bad luck, but certainly we would say if you have over 2% of ewes barren at scanning, if you are getting ewe lambs in lamb, then you will have a higher rate of empty animals, just because ewe lambs are less likely to take than second year lambers or older ewes. So if as long as you're not lambing for putting ewe lambs to the tup, anything more than 2% barren is too much. If you have anything more than 2% aborting, again, that's too high. And particularly if you have 2 or more ewes aborting over a 2 to 3 day period, this would really start to cause a red flag, and think of maybe enzootic abortion can cause these sort of abortion storms. So if you have several ewes aborting over a short period of time, this really needs to be investigated quite quickly. So yeah, if yes, then do investigate for an infectious cause, because it could be something highly likely there's something going on here. So this graph just shows VIDA diagnosis of abortion over the last sort of 17 years. So these are samples that have been sent in to the lab for diagnosis. And as we can see, the most common by far is enzootic abortion. This may not actually reflect that enzootic abortion is the most common. We do know that because of it being such a dramatic kind of onset, as in the ewes appear to be fine, and then suddenly about 3 weeks before lambing you get these quite dramatic abortion storms. So this does mean that farmers are more likely to send in samples, or that they're going to have samples to send in to the lab. So I think it may be that this is overrepresented compared to the other causes. Toxo is second, and actually I think toxo is probably a lot more common than this, but toxo is more of an insidious sort of onset. So you may get an abortion here and there, you may get some barren or empty ewes, apparently you may get some weak lambs born, but it's not quite so dramatic as enzootic abortion. So farmers are then more likely to put it down to bad luck and less likely to actually send in samples. So the diagnosis rate here is lower. Third is Campylobacter, and this does seem to be increasing year on year. So we are seeing more Campylobacter now. In a certain amount of cases, the cause of abortion is not found, and this is most commonly due to the fact that samples are sent in and are not diagnostic. They're not of diagnostic quality. So maybe the farmer had the abortion on a Friday night, but the sample's not sent in until Monday. And so I'd say that this is really up to the vet to discuss with the farmer and make sure that any samples sent in are of, fresh and recent. Particularly important to send in placenta, fresh placenta, and lamb stomach contents. If you can't send in the whole lamb and the placenta, that's really important. And I think also, if you send in samples that are not of diagnostic quality and the farmer gets results which don't tell him anything, he will lose faith in the diagnostic system. So it does really, it's sort of, benefits both you and the farmer to ensure that the samples you're sending in are of diagnostic quality. So going down the list, we're looking at Salmonella. Salmonella is actually diagnosed quite frequently in ovine abortion, and you can see you've got Salmonella many types here as number 5, and then also further down the list you've got Salmonella Dublin, Salmonella Montevideo, Salmonella typhimurium. So there are different types of Salmonella which are diagnosed, and certainly it's worth, if Salmonella is diagnosed as abortion, you need to get it typed, so you need to know what sort of Salmonella it is. There is one vaccine, an activated vaccine available for sheep Salmonella, but it does only cover one species, and it's a species that isn't always often found in the UK. So it is worth getting that. Make sure you check to find out what sort of Salmonella it is if you get that as a cause of abortion. We also have Listeria, Schmallenberg, probably less of that, nowadays, but it still can come on in waves. B. licheniformis, T. pyogenes, Yersinia, Hue fever, fungi. So there's quite a few different things essentially that can cause it. And we will talk about the top 3 here for sure, and we'll mention a couple of the ones further down. So here's some results from FlockCheck, which is the MSD diagnostic scheme that we've been running for many years. It's basically blood sampling from flocks which have had problems with abortions or barrenness or weak lambs. We need normally 8 samples from ewes that have been seen to have aborted or have produced weak lambs or have been barren, as we're much more likely to get diagnostic results from those animals because their antibody levels will be higher. And it's in that 3-month period post-lambing that we need to get those samples. So we run that every year, and this year, a few years ago, we actually then looked to see where in the country the samples were coming from. And as you can see, where there's a lot of sheep in Wales and north of England and Scotland, there is a lot of samples. And what was quite interesting was 96% of flocks that were tested were positive for toxo. So I think this does show to us that if there is a problem in the flock with fertility and you test, you are very likely to find something. 50% of the flocks were also tested were positive for Enzo. And there's a lot of sheep movement in the sales period. So 2.7 million sheep moved during the key sales period. And so, there are things like Enzo is very easy to pass, from flock to flock. Less than 1% of flocks are EAE accredited as well, so it isn't easy to buy Enzo-free animals. So this is a couple of years ago, again from FlockCheck, and this pattern seems to repeat itself year on year because we see the results every year, and in most years we get an 80 or 90% positive for toxo. We tend to get sort of 50 or 60 positive for Enzo, and then we all normally will get 50% or so positive for both. So this basically shows that if there is a problem, do get some blood testing done because there's a good chance you'll find something and be able to give the farmer an answer and then be able to create a plan for him or her. So let's have a look at toxo. Toxoplasmosis, can be known as white spot abortion, and it's caused by the protozoa Toxoplasma gondii. The life cycle can be a bit complicated, involves cats, and we will talk about that, and it's spread through the environment. This white spot is not pathognomonic, so although you may get a placenta and you may see white spots on it, certainly I wouldn't jump to the conclusion that toxo is the cause if that's what you see. And again, if you have a placenta which has got no white spots, it doesn't mean that toxo is not the cause. So although, yeah, you may get these white spots, don't rely on that to diagnose the disease. You need to send the sample off. So here's the life cycle. Basically, the prey is infected, so the mice or the rats on the farm. Young cats are mostly naive, and so they will catch and eat the infected prey, and then this passes the infection over to the cat. It's then a bit like a flu type condition, so they will be maybe a bit unwell, but they'll be infected certainly for a few weeks, and they'll be shedding a lot of toxoplasma eggs during that time. After a few weeks, their immune system will kick in and they will become immune, and then they're generally immune for the rest of their lives. But in that few week period, while they're becoming immune, they'll be shedding high numbers of eggs. And so these will go onto the feed or pasture or bedding of the ewe, so that if she's pregnant and she picks up those eggs, she becomes infected, and then she can either abort or produce weakly lambs. So some facts about the cat part of the cycle. The average weight of a cat dropping is, let's have a look, 50 grams. Average number of Toxoplasma oocysts per gram, 1 million. So you're already getting 50 million eggs. So every time a cat defecates, there's 50 million eggs into the environment. So that is a lot of eggs. And these eggs are quite resistant as well. They've got a sort of sticky outer coat, so they're quite good at sort of spreading themselves around and resisting, desiccation. Just 200 eggs will infect one ewe. So if you've got one cat dropping containing 50 million eggs, one cat can very easily infect the whole flock. It's very, very easily. And as I said, the eggs are resistant in the environment. They can last quite a long time. And we know really that cats, they go everywhere. They can get in the food, they'll go in the bedding, they'll go in the troughs, they'll go on the pasture. So it's very easy to spread the infection that way. And they can roam as well, over 200 hectares. People have done studies on cats where they've put collars on them to see how far they will roam. And it's surprising, like one farm has been shown to be visited by 5 or 6 cats from different sources. So it's very easy for that infection to spread. So the risk really comes from the environment. What's interesting about toxo is the timing of exposure affects the outcome. So if they're not pregnant and they get infected, that's okay. Actually, nothing will happen, and the ewe is likely to also become immune. So that's nice if that can occur. If then they are not pregnant, they get infected, fine. But if they are infected during pregnancy, there could be various outcomes. So early pregnancy, you're most likely to see resorption and what is then called a barren ewe, although probably she isn't barren. She actually did get in lamb, but the fetus was resorbed and never known about. If they're infected in mid-pregnancy, you can get abortion and mummified lambs. And if they're infected in late pregnancy, you could still get abortion or stillbirth, but you can also get weak lambs born. And one thing that I often think is a classic for toxo is if you get these twins where you have one strong lamb and one weak lamb, and you never quite understand why you've got this one weak lamb that just doesn't do, and that is often toxo that causes that. So this can resonate with a lot of farmers when I tell them about this. So how can we control it? It can't really be kept out of biosecurity, like normal biosecurity, like keeping a closed flock, because you've got the issue with the rats and the cats, which you're never going to be able to completely control. Exterminate all the cats on the farm? Actually, no. What you want on your farm is a stable population of older neutered cats. So older cats are more likely to be immune anyway, and neutered cats will roam less and fight less. So they will stay on your farm, and they will probably then keep off any intruders of younger cats that may be trying to get on the farm. So it's a good idea to have a sort of guard cat population, you know, of a couple of older neutered cats which are wormed regularly. Sorry, which are wormed regularly. It's the cats you don't want on your farm are the younger, naive, unneutered, unwormed type of cat. So they're the ones which are really the risk type of animal. What else can you do? Yes, so possibly you could give anti-protozoals in the feed, but this would need to be required every day. So this would need to be put in the food every day. And certainly we know that some sheep are greedy and probably would eat more than others, and some sheep would eat less. So it's very difficult to actually get the right dose without, you know, really overdosing them. And so I don't think that's a very sort of fail-safe way of controlling the condition, and also probably ends up being quite expensive, probably more expensive than vaccination if you're having to feed it every single day. So yeah, sheep vaccination is effective and practical. Toxovax is the only vaccine on the market for this condition, and you might understand why when I tell you a bit more about it. It protects against effects of infection for all stages of pregnancy, as long as it's given before pregnancy. So you will get less barren ewes and less abortions. It needs to be given at least 3 weeks prior to tupping, but it can actually be given 3 months to 3 weeks before tupping. And we always try and encourage farmers to actually give it as early as possible. So if they can give it 2 months or 3 months prior to tupping, this means that the demand on the vaccine manufacturer is lessened for us, and it means that it's easier for them to get hold of the vaccine as well, because they're not in that peak demand period. So the earlier they can if they can give the vaccine earlier, it really does help them and us. And then once it's given, it's only one dose and it protects for at least 2 years. In real life, we tend to find that one dose is enough for the lifetime of the ewe, because they will be exposed to toxo in the environment naturally, and so this will continue to boost their immunity to the disease. So once they've had the vaccine in the first year, they tend not to need another dose. So yes, as I said, MSD is the only company that makes Toxovax, and it's probably because it's actually a very complicated vaccine to make and distribute. It's certainly not simple and easy. So first of all, there's one facility in the world that make it, and they're based in New Zealand, and they have to make sure that they produce enough vaccine for the northern and the southern hemispheres. Obviously, it's nice that the two are opposite, so that they're not all at the same time. But yeah, once they've finished producing vaccine for us, they then move over and start producing vaccine for them. So it's complicated to make. When it's being made in New Zealand, that's a very complicated and technical process. It then needs to be frozen and transported to the UK in a frozen state. It must be maintained at minus 140 degrees. So this transport is very important, that it must be frozen. Then it arrives at the plant in Milton Keynes and it is activated. And this is actually quite a complicated process as well. So it has to be unfrozen and activated, ready for use. This is very time sensitive, actually. When it is then activated, it is ready to go. However, it is very vulnerable and will only survive for 10 days. So this is why we have a direct, it's called Toxovax Direct. This is why the practice can order it from us directly rather than going through the wholesaler, because we need to maximize the time that we can, you know, the quicker we can get it to you, the more time that their farmer has to use it. So it's ordered by the practice direct from us via the website. It arrives at the practice and then the farmer has 7 days to use it, basically. If the farmer does not use it within those 7 days, there is a risk, quite a high risk, the vaccine will not be effective. And certainly if we get any complaints about the vaccine, as in if farmers question the efficacy of the vaccine, this is the first thing I tend to ask them about. Have they stored it proper? Firstly, it needs to be stored in the fridge at all times. And secondly, have they used it within that 7-day period? Because if they haven't, and they've just left it a couple weeks thinking it will be okay, it's very likely the vaccine will not be as effective as it should be. Yeah, also, we're limited as to how much we can for and pack and dispatch of the vaccine. So our peak season is September and October. That's when everybody wants to vaccinate because they're all tupping at that point. So we are maximum capacity then. If anything goes wrong, or if we get any kind of surge in demand at that time, it can be difficult for us to meet because we have to plan for exactly the amount that we think we're going to get. So as I said previously, the more people that, or the more farmers that can actually move their vaccine period earlier, and if they can vaccinate in June, July, August, that means that they actually it's quicker for them to get the vaccine. There's less stress about getting the vaccine because it's not in that peak demand season, and they'll still get just as good a protection. So if I would always say to try and encourage your farmer, if possible, that they can vaccinate earlier. Obviously, some farmers will be buying from the sales in autumn and vaccinating straight after, in which case they can't change that. But if they can vaccinate earlier, that certainly makes it less stressful for everybody. So yeah, ones that are like early lambing flocks, they could certainly, if they're lambing in January, they would definitely be able to consider vaccinating earlier. Those that breed their own new lamb replacements, again, they'll be already on farm, so they can be vaccinated earlier. Or if they buy in their replacements early, they're another group that could be vaccinated earlier. So always worth mentioning this to farmers. Right, that's Toxo. Let's move on to enzootic abortion of ewes, or EAE. It also has other names, such as OEA, chlamydial abortion, or kebbing, which I think is an Irish term. The cause is a sort of bacterial-like organism called Chlamydophila abortus, and it is widespread throughout the UK. So if you're buying in sheep and not buying from an accredited flock, it is a risk. And you get these small poorly formed lambs aborted about 3 weeks before due term. And the cause of abortion is this placentitis. And but you can't tell that just from looking at it. You do need a lab diagnosis. You need to send in the placenta and the lamb. And you can see here the placentitis. The placenta is inflamed and swollen. But other diseases also cause placentitis. So how is it transmitted? It's from sheep to sheep at lambing time. So if you're classically before lambing, 3 weeks before lambing, all the sheep will be gathered together in a barn probably. And if one aborts like this, you then see all the sheep will then come over and sniff it as they do, and sniff the sheep and the fluids on the ground, and it's highly infectious. So they will then become infected themselves. It's zoonotic as well. So if a sheep is aborting in a shed like this, if a pregnant woman comes along, she can get infected that way. So it's highly important that pregnant women do not go into the lambing shed. How does it then cycle round? So as I said, we get these late abortions. Other ewes will come over and sniff that and get infected. They lamb normally. So this is the trick of the disease. The sheep lamb normally, and there is no sign to show that they've been infected. They look completely normal. However, they are latently infected. So they have this latent infection, which they carry with them till the next pregnancy. And at the next pregnancy, this placental infection occurs, and then they abort the next year. So what you might see typically is this one where you have a few aborting ewes at the first year, so you may get like 5, and the farmer thinks, oh, that was a bit bad, but could have been worse, maybe just been bad luck. The year after that, you'll have like 25, or maybe more. So it's this sort of waterfall effect almost. And every time one aborts, it becomes a carrier. Every time one is infected, it becomes a carrier. But then they abort, and then they are still a carrier. So they will always be a carrier once they catch the infection. They will be carriers throughout their lives. So they will shed bacteria every time they lamb, and they will infect other sheep at this time, and they can even infect their own ewe lambs. So when they give birth to their own ewe lambs, those ewe lambs can be infected, and then they can abort when they lamb in a few years' time. So it just goes through the flock, cycles round and round through the flock. It's very difficult to remove unless you vaccinate. Yeah, so disease is maintained. Ewe lambs infected at birth and naive replacements. not pleasant. Farmers, you know, when they've had this, it's pretty nasty. Like, you know, I think some farmers are scarred for life after they've had this. It's not a nice thing to have. So yeah, like I said, it's you buy in these latently, or somehow you get hold of these latently infected replacement ewes. It's normally from buying in, to be honest, because you can't tell that they've got Enso, they look normal, so you buy them in. So a few are bought at the first lambing, maybe just you think, oh, it's just a bad year, don't worry about it. Infection spreads to the rest of the flock, and then you get abortion storms years and in subsequent years, and abortion rate remains high. So what can you do to control? It's a bit different to toxo. Keeping a closed flock will certainly is certainly effective, I think, if you can make sure that that is guaranteed and maintained, particularly also if you're blood testing and sourcing disease-free replacements from EAE accredited flocks. If you have aborting ewes, definitely you need to remove them immediately from the group, tag them, test them, get rid of any bedding or anything that's touched them and burn it. There certainly has been known to, even if you do have a closed flock, it has been known for wildlife to, you know, carry aborted material from one field through the fence and into the next field and infect a flock that way. So just because your flock is clean, but if your neighbour's flock isn't, that could certainly be a risk. Antibiotics, yes, as in this used to be and still possibly is on some farms, but a lot of farms used to use antibiotics prophylactically to prevent this. It does work, and we'll talk a bit about, but it comes with many side complications, which we will talk about, and then vaccination, which we will talk about. So antibiotics. I think if you're called to see a farm, a flock where they don't vaccinate and they're in the midst of an abortion storm, I see that antibiotics in that situation would be required because you want to prevent more sheep from aborting, and they do work in that situation. So I think you're justified to use antibiotics in that respect. However, in the long term, using antibiotics every single year does not actually eliminate the disease. Infected ewes will still shed it and spread it to uninfected sheep and replacements, and the ewe lambs will still be infected at birth. So although it will reduce the amount of abortions, the infection is still cycling within the flock. And we have this pressure now to reduce our antibiotic use. It's not a you know, justifiable reason to use antibiotics to prevent abortion anymore. And it was certainly identified as one of the rumour targets task force areas where abortion was one of the areas where antibiotics should be reduced. Yes, so I think fine, use antibiotics if you have it 1 year and you need to stop abortions in that period, but then going forward, a flock with an enzootic abortion problem needs to start vaccinating. This is the only you know, justifiable means of control. So it's Enzovax is the vaccine we make. It prevents abortion in clean sheep, as in ones that have never been infected and not latent carriers. If they are latent carriers, it's licensed to reduce abortion and reduce shedding. So it's these sheep that are latently infected will always be latent carriers, and they will always have issues to an extent, as in there may be some shedding and they may still abort. However, if they are vaccinated, the vaccine will massively reduce the shedding, particularly, so the risk of infecting others is much reduced, and it will reduce the risk of abortions too. You do need to when you first start using these vaccines with farmers, it is worth sort of managing some expectations, because certainly in the first year or two, they won't go from having loads of abortions to having no abortions. In the first couple of years, they will still get a small number of abortions. And this is because if you look at this diagram, on the left-hand side, we have unvaccinated herd. So we have the red ones, which are latent carriers and or infected, and the black ones, which are naive. If you then vaccinate this whole lot, you move over to the right, where you get the black ones have turned blue, so they're now protected because they were not latent carriers, they were naive, so they've been vaccinated. They're blue. That means they're protected. That's all good. The ones that are red will still be red, so they are still infected because they're latent carriers. There's still a risk of them aborting, but it will be lower, and the amount that they shed will be much lower. If we move into year 2, obviously some of these animals will be taken out of the flock due to age or what have you, and new animals, which are hopefully naive, will be then put in to replace them. So then we vaccinate again these replacements, and they get moved into the flock. More of the flock is blue, less is red, risk is even lower, even fewer abortions. Year 3, again, a proportion of the flock will be moved out. New replacements will be brought in and vaccinated while they're still naive, and even more proportion of the flock is blue. So this means that year on year, your abortions will go down, down and down and down. So by sort of year 3, 4, you should be getting no abortions really at all. You know, pretty much the whole flock is protected at that point. How do you use it? It can be given 4 weeks, at least 4 weeks prior to tupping. So again, this can be given in the 3-month to 4-week period prior to tupping. So if they can, again, if they can do it earlier, there's nothing to stop them from doing it earlier. And actually, we would recommend that. It can be used on the same day as Toxovax, just given in a different location. And also similar to Toxovax, generally you only need 1 dose for a lifetime of protection. So although it does appear initially expensive to be vaccinating with both Enzovax and Toxovax, if you're giving 1 dose per ewe for her whole life, and she produces 2 lambs per year, so around 8 lambs or so in her lifetime, it actually only ends up being about 50p per lamb overall. So to me, that seems very cheap to be, you know, protecting against abortion of those lambs. Why vaccinate? Well, it's kind of what I said. The economics, you get lower fall in stock charges, obviously, because you're not getting ones taken away, more lambs raised. Abortion cost has been calculated to be around £127 per ewe per season. So that includes the cost of the lost lamb, disposal, etc. So you would be saving on that amount. And then obviously you'd be selling the lamb for money. And the cost of the vaccine, as I said, you divide the cost of 1 dose by the number of lamb crops per ewe, and it ends up being very cost effective. So in summary, these two diseases, they are very different. Toxoplasmosis, it can't be controlled by biosecurity because you can't control the cats and things that come in. Enzootic abortion, you can maintain a closed flock and possibly keep it out that way, but it causes these, you know, quite dramatic abortion storms. Yeah, unlike Toxo, which is quite insidious, Enzo is more obvious and dramatic, but they both cause sort of equal problems. So if you have a farmer who wants to start vaccinating, how does he go about it, or she? Initially, and this is the gold standard, so gold standard we'd recommend they did the whole flock while not in lamb, so a month pre-tupping. And then every year you just need to do your replacements. However, some farmers sort of bulk at the cost of this, and in which case I think it is also acceptable just to, in the first year, do your replacements, and then every year do your replacements. If you do it that way, obviously the older sheep that you haven't vaccinated are not vaccinated, so their risk is, the risk of them aborting is still there. However, you're protecting your new sheep coming in. So after about 3 or 4 years, every sheep in the flock should have been vaccinated as you've replaced the old ones with the new ones. So that is a slower way of doing it, but maybe less expensive. However, we would always recommend to, you know, do the gold standard if possible. To make it easier, yeah, as I said, Enzovax and Toxovax can be given on the same day. So that's Enzo and Toxo. I'm just going to mention a couple of other causes of abortion. Campylobacter. Campylobacter fetus and Campylobacter jejuni are the 2 most common causes. Bacteria enters and is maintained in the flock via carrier sheep, and feces and wildlife can spread it. If the flock is naive, there's a high abortion level to start with, and then they abort, and then immunity sort of comes through. The abortion cycle tends to go over sort of 3 to 4 years as ewes are replaced and then new naive ones come in. To control it is difficult. You can maintain replacement ewes separately until after the first lambing. So that means that they have their first lambs and aren't infected while they're pregnant. And then once they have had the lamb, if they then get infected while they're not pregnant, it's not quite so much of a issue. There is a vaccine not available in the UK, but it can be imported, called Campivax 4, and certainly it seems to be a good vaccine, and some practices do import that. And again, sort of hygiene and keeping a close flock will help in some situations. The next one's Q fever, which is caused by Coxiella burnetii, a gram-negative bacteria. This is shed in all kind of everything like milk, feces, urine, abortive material, birth fluids, placenta. So it's shed quite everywhere. And it can cause infertility, anorexia, and late sporadic abortions. And it's maintained through a tick reservoir, so it is more common in places where there are high numbers of ticks. It needs to be diagnosed in the lab. This is a zoonotic disease as well, another zoonotic disease. So people may not show any signs, or they may show signs of a cold or flu and not realise it's actually Q fever. In countries where they've tested vets and farmers for it, the seroprevalence is actually pretty high. So a lot of vets and farmers do have antibodies to it. If we're worried about this in milking animals, then it will be pasteurized. It is killed by pasteurization. Only 17 APHA diagnoses, 2002 to 2017. Doesn't mean it's massively rare. It just means that people maybe don't test for it and don't realize they have it. So this would be one that if you've eliminated other causes of abortion, possibly could be one to test for. Finally, just going to mention Neospora. Neospora caninum is considered an important cause of abortion in cattle worldwide. The relevance of abortion in small ruminants is considered limited. However, the parasite has been isolated in use and transplacental transmission has been demonstrated. So basically, if you have a farm where they are raising cattle as well as sheep, then and Neospora has been diagnosed in the cattle, and if they're having abortions in the sheep, it might be one to consider. I think this is an unlikely cause, but yes, if there's a cattle and sheep mixed farm and having abortions in both, that just might be something to think about. Great. Thank you for listening to this presentation on sheep abortion. I'm sorry I can't take any questions as this is a pre-recorded CPD. However, if you do have any questions on this presentation, please do get in contact with your MSD Animal Health account manager and they can forward any questions on to me. Thank you very much for listening.